your protections. In addition to establishing the marketplace, the Affordable Care Act also codified patient protections. If you may remember, the full name of the Affordable Care Act is Patient Protections and Affordable Care Act. Before the ACA was passed in 2010, this wasn't the law. The ACA really required insurers to abide by what you see there in that photo there. So it requires insurance plans to cover people with pre-existing conditions, including pregnancy, without charging more, provides free preventive care, gives young adults more coverage options, and really that's to stay with their parents' plan up to age 26. And you can just go on down through that list of the protections that the ACA put into place. And these are things that we want young adults, we want everyone to be aware of, that these are, ACA was there, it's currently the law of the land, it's there to protect patients. Despite those protections that are there are still challenges, as you all know, and as you had listed out for me, when it comes to accessing healthcare. There's still quality of life issues that insurers may or may not address. There's still barriers to accessing care, and some of those times it's coming from the insurance companies. How many of you are familiar with prior authorization? Have had to go through that process. That's what we at NPAF anyway. That's an insurance barrier, as well as step therapy practices. Step therapy is when, say, a physician prescribes you a drug, you go to your pharmacist to fill it, you find out that it's denied because they are saying the insurance will only cover the generic version. So it's a cost containment practice that is called step therapy. And really what that does is that it ends up delaying the care or the treatment that patients need. Network status, we talked about that already. Oftentimes, many people don't consider the structure of their network when selecting a health plan. And so they learn a little too late whether or not a particular service is in network or out of network. And usually what that ends up resulting in is a surprise medical bill. And the other thing that people don't really consider when selecting insurance, or something that they, or a challenge that they may encounter even once having insurance or with insurance, are just the out-of-pocket costs. Those are things that we oftentimes just don't know what it is, other than what our premium is going to be, what what deductible we need to meet. Sometimes the co-pays or the co-insurance are things that we find out later on. And as I mentioned, the surprise medical bills are usually what result from not knowing whether or not a plan is, or a certain provider or a certain service is in network, or if it's out of network. And I think many of you have seen have heard stories about getting a surprise bill, a surprise medical bill. Has anyone here experienced that, where they've gone to an out-of-network provider unknowingly and then ended up getting a surprise medical bill? I see some heads nodding. So this was something that was in the news recently, or a study that was done recently. 54% of Americans have received a medical bill for a cost that they thought was covered by their health insurance. So, despite everything that, we think insurance should do for us, these are still some of the things, this is still our reality. These are some of the things that we still need to deal with. And I think partly why we have the case managers that we do to help. So with those challenges, there are support for people to make sure that they, can get out of those situations. So I just wanted to call attention to the public programs that are there to help with access, and just to allow young adults, especially young adults who are survivors of, whether it's, a childhood cancer or any other disease or serious illness, these are programs that will allow you to live independently. So we have the Supplemental Nutrition Assistance Program, SNAP, that's formerly known as food stamps, Low Income House Energy Assistance Program, the Temporary Assistance for Needy Families, as well as Supplemental Security Income, as well as private programs just within the communities that can really help people. And I think Patient Advocate Foundation is a very important safety net, so I included it there as well.